Je vais te le dicter là.
Ok.
Ouais. Alors, c'est W, H, O, C majuscule.
W, H, O, C majuscule. Change.
I majuscule. T minuscule. Point d'interrogation. And. W majuscule. H. Y.
Je vais dire I
L majuscule, L minuscule.
C'est juste que c'est I majuscule, je pense que c'est L minuscule.
Non, c'est L, really.
Ok.
Skanda, Maristi. We're live. Hello, Marie.
Is it working?
I believe so. Can you guys hear me? I think it says live and we're ready to go.
Oh, yeah. Okay.
Yes.
Then,
Can you all
Marie,
hear me well?
Yeah. Yeah, mine.
Perfect.
Okay, so now we're live. Apologies for the small technical difficulties that we had, but now it's all up and running. And welcome to the webinar about the new initiative by the IFMSA team of officials about global external focus areas. This webinar is created in order to inform you more about what we're proposing, the way we'd like you guys to give input, and also this is a way for you to ask questions and get a bit more to know about what we've been thinking as sort of the thoughts and the reasons behind what we're proposing. So there will be time for questions in the end, where you both will be able to put them either in the Google event, where you can write them as a comment, or it could also be possible to write them as a question within this Hangout Air platform, if you're able to do that. So please think about the questions while we are presenting, and in the beginning it will be me going through some of the background of an introduction to this proposition, and then afterwards it will be some of the other liaison officers going more into detail with the specific areas that we are trying to focus on, suggesting to focus on. Right. So who will be here tonight? We have the liaison officer for public health issues, Skanda Isakri. We have the liaison officer to human rights and peace issues, Karim El-Sayed. And we have the liaison officer to medical education issues, Stein de Dijk. And then myself, the liaison officer to the World Health Organization, and my name is Maria Halstead. So that's the plan for tonight, and now I'd like to go on to the next slide. Yeah. So a bit about why we need this change. So the way we work in external representation at the moment is that we work in a lot of different fields that relate to global health. And actually global health is such a huge scene that, and as IFMSA at the moment has not decided where to put the focus, our work at the moment is very sort of directed and decided by external factors, so other partners that we work with and what is going on at the global agenda, and also by some of the predecessors, what they have started, some of the processes that are already ongoing. And therefore, it is not as such something that IFMSA has made a decision about, we want to focus on this and that, rather than that it is something that the NMOs actually have had a say in. So therefore, we propose this, also because it's difficult for the NMOs at the moment to know what to expect from the TO, and it's also therefore difficult for the TO to know if we're actually living up to the expectations of the NMOs. So And furthermore, we believe that we have like a varying degree of continuity between the terms. So this both depends on who is in office, how the handover process has been, but also that there is no sort of official documentation of what the person or what the TO was meant to do in external representation, and therefore also not a way to monitor whether this has been fulfilled or not as such. And there are so many opportunities for IFMSA out there, and we truly believe that we could get more out of the work that we do within external representation than that we are at the moment. So this is why we need the change. Next slide. And how would we benefit from this? We believe that we could benefit from it by having a more streamlined external representation, and that by being more strategic and being more goal-oriented, that we could actually achieve larger impacts within certain fields. Maybe we could even, IFMSA could become a big player within some certain topics, and we would be recognized and renowned as this. Furthermore, there are sort of very basic things around how we focus the daily work of the TO in external representation, and this document, adopting this, could really be a guide to what events should the liaison officers go to, what abstract should we submit when we go to a meeting at the WHO, which has to do with so many different fields within global health. What agenda items do we make official statements on? And furthermore as well, which partnership should we build? We have a lot of good partnerships at the moment, but sometimes we need to put sort of an effort into some of them to make them work, and whether the decision of which partnerships to really work on and to really focus on, and what partnerships to focus less on, also is a prioritization, and these decisions are important that they're made by more people, or also that the NMOs are involved in this rather than just individuals. So thereby we also believe that we can have a higher degree of transparency to the NMOs and also to our partners, and that there could be more alignment of the work between the positions, so that the different liaison officers would work more together and also could talk about each other's areas more, maybe in relevant meetings as such. And we hope as well that in the future, maybe this kind of proposal could give us a larger degree of continuity between the terms. Right, next slide. So what is it that we are proposing? We're proposing a set of global external focus areas, and we're proposing to have them democratically adopted, which means that we are proposing to have sort of a vote during the IFMSA GA at the August meeting in Mexico coming up here in 2016. We're proposing to have this and to have it functioning as a strategic tool that guides the Vice President of External Affairs, the liaison officers, and the regional directors for the next term. So basically this has to do with all the work that we're doing in external representation. Finally, after the adoption at August meeting in Mexico, we propose that the TO that is currently in office, together with the TO-elect, together figure out what kind of goals would be relevant within each field, what indicators and also what action points would be good to have for the next term and would make IFMSA achieve more within our external representation efforts. And then it's also important for us to mention that although we do mention this list of focus areas, there will still be possibility for IFMSA to work in other areas of external representation. Next. So our proposal is, in a brief overview, that we propose to have 7 focus fields that are sort of more related to specific areas within global health, and then 3 overarching top concepts. And these overarching concepts will be things that, or concept that we could always apply no matter almost which focus field or which area we were talking about. We could always talk about these, and these would always be relevant to IFMSA. And the way that we came up with this proposal is based on both sort of an assessment of the internal things that we work on in IFMSA, as well as the external fields. So that is, we created this stakeholder analysis of all of the partners we work with, as well as we've been looking into what are the hot topics in global health at the moment, which partners do we have that are really strong that we'd like to keep on working with, where do we think it's important that medical students have a voice. And therefore, altogether, this has, and hereby we've come up with this proposal. And it's very important to say that we've really been trying to incorporate the thoughts and the knowledge of all the liaison officers, and that the liaison officers themselves are experts within each of their area. And also we've been sort of consulting with the standing committee directors. So that is how the process has been, and this is the proposal that we come up with. Next one. And here we go. The focus areas that we propose are divided into the focus fields and the overarching concepts. So the focus fields that we propose are social accountability in medical schools, primary healthcare, non-communicable diseases, climate change and health, sexual and reproductive health and rights, emergency response, refugees and migrants' rights and health. And the overarching concepts are health in all policies, health workforce, and meaningful youth participation. Next. And here just an overview of the timeline that we're proposing for our internal adoption as well. So now we've shared this proposal with the NMOs, and you've been informed about the process. We've submitted the proposal of these global external focus areas, and from July 1st until July 20th, we have this consultation with the NMOs, which is both taking place on the NMO server through the email thread, as well as through this webinar, where we will be taking minutes, of course, of all of your questions and concerns. And within this period, we would kindly ask you to suggest the larger amendments that you might have to the proposal, because this will really ease up the process a lot if we will be able to, by August 1st, have this a final proposal, which is something that both the TO and the NMOs will be likely to agree on. And thereby, throughout during the GA, we will be able to just adjust with minor amendments and have a really good document that people are able to be informed about and having read in detail when we then have the vote on August 6th during the last plenary. And yeah, I just want to say and really underline that we're very open to all of your input, and we really hope that we can, and we believe that we can have a document in the end that we all agree on and are happy with. Next. Yeah, so now I will stop talking for a bit, and I will give the word to the other liaison officers, and we'll talk a bit about the different focus fields now. And first up, we have social accountability in medical schools with Steinche.
Yeah. Hi, so welcome to this webinar. Like Marie said, my name is Steinche. I'm the liaison officer for medical education issues. We'll try to be very short on the different topics that we're proposing, and you can ask your questions afterwards. So why social accountability in medical schools? Well, as you know, the IFMSA is very much focused on health equity principles, on serving the communities and being responsible to them. And this focus point is exactly that, but for medical schools. As you know, in a lot of countries, medical schools are funded by societies. They aim to prepare the health workforce for actually serving them in the end. And this principle actually tries to support medical schools to be socially accountable. How? Well, through various already existing concepts, so that their medical education is focused on the society and not a past scenario from years ago, that really focuses on meaningful and strong governance and partnerships, so everyone who is related or is influenced by how the school works, so for example patients, communities, and medical students themselves, that medical schools actually work together with them that there is actual quality of the medical schools. A lot of medical schools worldwide are not properly accredited. We don't know how actually medical students graduating perform later on in the societies. So basically this point tries to work to implement already existing standards in social accountability in medical schools. The idea is that now we're already working on a toolkit that would help you on a local and a national level to actually go to your medical schools and review different criteria on how well they are performing now and how to improve. And next year there will be the World Summit on Social Accountability, which makes it even more pressing to work on this now, because actually next year we're going to adopt a new set of recommendations. IFMSA is part of the leadership of this new World Summit, and we'll be able to have a lot of impact in the next year. And that's it.
Can you guys hear me?
And next up we have Skandar Safri with primary healthcare.
Very good. So I will put my video on. Yeah. Hi everyone. My name is Skandar Safri, and I'm the IFMSA Liaison Officer for Public Health Issues. And I will start with the first topic, more or less related to public health, which is primary healthcare. So reminding the Declaration of Alma Ata from 1979 that defines primary healthcare as essential healthcare, and seeing that it is like the topic of primary healthcare is getting more and more focus within the international global arena, seeing it as a very strong tool to improve health systems and a very good indicator for stronger health systems worldwide and from the higher to the lowest income countries, and also the fact that we have many internal and external activities that deal with improving our capacity as medical students to advocate and also to build capacity on primary healthcare, but also on some of the subtopics when it comes to primary healthcare in the rural settings, which is in short rural health, but also preventive medicine and different activities that can be done to actually prepare us to get closer to the population, but also be more involved in the process of improving primary healthcare within healthcare systems. And some of the biggest actors that are involved in the topic of primary healthcare are the World Health Organization, but also the global family doctor organizations, with whom we are one of the biggest partners. We get to participate. For example, in regards to WONCA, there's the WONCA World meeting that is happening once every 3 years. That falls in the next term, which is in November in Rio, where there will be discussed many aspects in relation to primary healthcare. But also specifically in relation to rural health, there will be the World Rural Health Conference also next year in April, and we are expected to get very much involved from the students' perspective and to input when it comes to how to prepare medical students to be strong advocates for primary healthcare. So, would you like me to go next, or Marie?
Okay, well, we have Skandar again with non-communicable diseases.
Yeah. So very quickly again about non-communicable diseases, as most of you already know that they represent of the global burden disease. The main communicable diseases are represented by 4, and in accordance there are 4 main preventable individual risk factors that we are targeting. So it's mainly tobacco, alcohol, physical activity, and diet, but also other factors that are mainly linked to social and political aspects. And at the international arena and the way we work at the external level, there are different international frameworks and organizations that are working to implement the NCD Action Plan 2013-2020, and we are working together with the WHO, with the NCD Alliance, NCD Child, and other organizations, so that we try to join efforts and target different groups, including the youth, but not only limited to. And we are also trying to input or contribute to the creation of health policies, not only in the international level, but also at the national level. And since 2 years now, there has been created the NCD Global Coordination Mechanisms, that was created in the World Health Assembly, and we are one of the observers of this platform that is meant to work on the implementation of these platforms, especially at the national level. So several consultations are taking place, and we are also expected to get more involved in the future.
And then we have Skandar again with the climate change and health.
Yeah. So the same. So as most of you already know, that we have been very much involved in the different climate processes from the past years, especially in the two recent years where there has been much more evidence on the climate change impact on health, but also the opportunity behind it, so that we can explain to or show to the population that we can act on our individual or population level to combat climate change. And at the political level, several discussions have taken place, and the youth and medical students have been involved, whether it is the United Nations Framework on Convention on Climate Change conference, of which, like the recent one, has led to the Paris Agreement, if you have heard about it, that is meant to bind member states so that they can get to implement specific measures in relation to climate, but also health measures that that would make the health systems more resilient to the climate, but also in relation to the Sustainable Development Goals, where climate is pretty much preeminent. And finally, WHO and other partners that are also taking positions, and we are either joining them or also presenting our own initiatives. And the recent one that you must have heard of is the IFMSA training manual on climate and health, that is supporting students to actually build capacity and campaigns on the topic.
Yeah, and now I'll now it's not Skandar anymore. Surprisingly, it's me. So it is. I'm going to present this on behalf of the liaison officer to sexual and reproductive health rights, who is Michalina Dreitzer, and the focus field is proposed as sexual reproductive health and rights, or SRHR, and really it's about access to sexual reproductive health services, including comprehensive sexuality education, which is also something IFMSA works a lot on internally, as you know, safe and legal abortion, family planning services, which there are a lot of conferences and have been a lot of conferences about this year as well, which Misha has been joining, HIV and other STIs, gender-based violence, and sexuality and gender identity, which is also something that we both work on internally and externally. So I advise you to contact Michalina, as she has also asked me to do this, if you have any questions regarding this particular field, as it is certainly her expertise rather than mine. So I think we'll just jump on to the next one, which is Refugees and Migrants' Rights and Health, with Karim Al-Sayed, the liaison officer for human rights and peace issues.
Hi everyone, I'm excited to be here and excited to talk to you guys. To start talking about refugees and migrants' rights, for IFMSA, the rights and health of those forced to flee is a major priority, but we need to understand why is this a major priority for IFMSA. So just for instance, the top 5 killers for children under 5 are all health issues. Mostly are malaria, malnutrition, measles, diarrhea, and respiratory tract infections. But aren't these health problems curable, and aren't they preventable? The 1951 Refugee Convention states that refugees should enjoy access to health services equivalent to that of the hosting population, or the hosting country, the host population, while everyone has the right under the international law to the high standards of physical and mental health. However, nowadays, with the refugees crisis becoming more protracted and increasingly involve more people displaced within countries as well as across borders, we have some 55 million people are currently displaced. More people fleeing country due to violence, more than World War II at any time since World War II. Their needs are becoming highly diverse. Preserving the right to health at the time of emergency linked to violence is a shared responsibility among all the health providers, including the medical students. We need to not only treat the communicable and non-communicable diseases, but also mental health care, care for children, and maternity care, since women and children are more than half of the world's refugees. Some of the difficulties that faces healthcare when dealing with refugees are difficulties in language barriers and cultural differences. And this is why in IFMSA we have a vision where all individuals are entitled to full and equal access to their human rights, including health, leaving no one behind, no matter whether it's in a disaster, conflict, or an emergency setting. And hence, we need to build the capacity of medical students on two levels. Most importantly, as future health physicians, we need to be able to provide these health services to everyone, including refugees, in a culturally appropriate manner, understanding their needs and being equipped with the skills to tackle these issues. But also, we need to have medical students to advocate within their communities, calling for respecting the rules for prevention and ending conflicts, strengthening the protection of refugees, and also to ensure that humanitarian programming is responsive to intersectional, multiple, and other forms of discrimination within their communities for the refugees. So this is briefly about refugees and migrants' rights and health, and why we in IFMSA identify this as a priority and why we need to act towards it.
Right, thank you, Karim. And then I'll give the word again to Karim to talk about emergency response.
Thank you, Mary, again. Talking about emergency response, nowadays the world faces a wide range of emergencies resulting from various hazards and differing in scale, complexity, and having different international consequences. Over the last decade, from 2001 till 2010, there has been over 700 natural and technological emergencies, causing over 130,000 deaths annually. Now, this is a large number according to the World Disaster in 2007. To effectively respond to an emergency or disaster, medical students must engage in preparedness activities. Just jumping also to say that these emergencies that happen, we just said 700 emergencies happening over these 2 decades, this decade from 2001 to 2010. These disasters, these emergencies damage hospitals and the health infrastructure, they weaken the health systems, and also slow the progress towards achieving goal number 3 in the SDGs, which is health for all. Preparing for and responding effectively to such emergencies is now become more crucial than ever. As medical students, we graduate, but we're often unsure of where we're going to be working. And even if we're sure if we're going to be working in one place, whether it's in our country or abroad, we're unsure of the settings that's going to happen in the future. So it's very unlikely that with the rise in the emergencies, including the conflicts and violence worldwide, the chances that one of us is working in an emergency setting has now become higher than ever. And therefore, it is important, it has been identified as a priority for IFMSA, and our aim through emergency response is to prepare the medical students with the necessary skills and knowledge to be able to work in these emergency settings, to uphold the highest quality of healthcare attainable to those in need, particularly children and women, since, like mentioned earlier, are the most vulnerable groups in such settings, as well as provide medical students with the skills to advocate for their rights, for the protection of the places they work in, that is the healthcare premises, the healthcare facilities, as well as advocate for the access of healthcare in emergency settings for all. Just on a final note, one last thing I'd like to say is that interconnection between emergency response and humanitarian aid for refugees and migrants have now become more closely interlinked than ever. So terms, buzzwords, efficiency measurements used by these two sectors now need to be aligned. Ultimately resolving healthcare crises, whether in emergency settings, in conflict settings, or for refugees and migrants, means resolving conflicts themselves. We must not lose sight of these for lasting peace. As a final example, the UN Relief and Work Agency provides 137 primary health centers for places like Syria and Palestine. The health of refugees is has become a political issue, and the same goes with the emergency response. It has become a political issue, and therefore it is a very important topic for medical students to not only be aware of the health conditions in these situations, but to also understand the bigger picture for in order to protect themselves, working in humanitarian field, in the emergency response field, as well as when tackling the health needs of the refugees and the and migrants. I guess that's it for emergency response. And moving on to Maddie.
Thank you so much. And now, just before we move into discussing the overarching concepts, I would just remind you all to ask questions if you may have any, and yeah, please keep it in mind so that we have time to think about them and also find an appropriate answer before we start speaking. So please think about this. And now we're moving into the overarching concepts. So just to sort of recap a little bit, we've been discussing now the focus fields, which were more sort of content-based, and now we're going to go into sort of the overarching concepts, which can be applied almost no matter what topic we're talking about. Okay, so the first one will be health in all policies with Skander again.
Hi again. Thank you for having me. So in relation to health in all policies, as Mary mentioned, that it is an example of a topic that can be applied to many of the topics that have been addressed, but also the fact that we have been very much focusing not only as medical students, but at the health community to putting health in different settings, but also encouraging multidisciplinary collaborations in order to take health into account, but also to see how we can share best practices and learn from each other's experiences. So it is basically focusing on how much global decision makings across sectors can have a better impact by promoting a multidisciplinary collaboration and putting health in different global discussions, but also by addressing the social determinants of health. As many of you already know, for example, transportation, education, access to healthy food, etc., that perhaps do not have a direct link to health or how health professionals can act towards them, but the link is actually more and more obvious, and seeing how we can collaborate and build up a discussion to be more efficient in the way we are addressing it has been already been proven. Also seeing that the Sustainable Development Goals have one goal number 3, that is focusing on health, but not only we can see health in different other goals, and seeing the different reports that have been shared where we can actually have a better impact by getting more involved as health professionals and health professionals to be. And finally, seeing that the way we can do it, it can be either at the students level. So one of the striking examples can be the World Healthcare Students Alliance, where we can also expand to other students groups so that we can see how we can join efforts to achieve it, but also on the professional level where we can collaborate with other professionals from the medical and non-medical disciplines. So for example, it can be in relation to the WHO and other UN agencies, but also other professional organizations. So yeah, thank you.
Great, and now we move on to health workforce with Steinche.
Yep, hi again. So we're talking about health workforce, which basically involves everyone who is working to deliver healthcare. So whether it's doctors, whether it's nurses, whether it's physiotherapists, actually anyone. And it goes beyond just medical education. We're talking about people that are becoming health professionals, but we're also talking about the health workforce that is already there, so already existing doctors, or health workforce planning for how many people do we actually need working in health in the future. Why is this an overarching concept? Why is this not just about medical education? Because as you heard in all of the different topics, at certain moments we talked about how medical students need to be prepared to get involved in emergency response, or how they should be trained to actually work on issues related to climate change in health, how they need to be aware about how social determinants influence health. So all of these issues have something to do with how we prepare our future health workforce, or they have something to do with issues that our health workforce are facing. For example, that we find that we don't have enough people of a certain specialty in a certain area, or whether we find that our current health workforce doesn't know enough about sexual and reproductive health and rights. So why now? Because in the last 4 years, health workforce and human resources for health, which is a bit broader, it has to do with everyone who is also health allied workers. It's become more and more important within the IFMSA. The first 2 years we worked majorly on finding out what are the major issues that, according to us, the health workforce is actually facing. Then we had 2 years now working on solutions, and now a global strategy was adopted. Now we need to actually work with our partners, with our universities, with our governments to make sure that they actually implement the recommendations from the WHO, from the Joint Action, from all of these people that have come up with certain recommendations for both making changes as well as data collection. And why us? Because we will be the future health workforce, so this is extremely relevant for us. And I think we all believe that the issues that IFMSA chooses to work on should be unique areas where we have a different perspective than the other people already working on it, and we have a certain say in the topic that we want to discuss. So this is why health workforce is chosen as an overarching priority. And then I think the next one will also be for me.
Yes, you can just continue with meaningful participation.
Yeah, perfect. So this has something to do with all kinds of external representation that we do in whatever field. Why does it say meaningful youth participation? Because we know a lot of organizations that see working together with medical students or working together with youth is a sort of trendy thing. You know, if we want to be recognized as an organization, we need to talk to youth. So what do? We just ask them what do we think, and then we go on with the plan that we already had from the beginning. That, like using youth or students as tokenism. We added this as a overarching pillar to make sure that we go beyond just students being present somewhere. We really review all of the partnerships that we have, whether it's our international partnerships or it's building capacity for the local and the national level to really reflect on what is the role of youth. Are they just sitting there? Are they actually being consulted? Are they part of the solution and part of working towards something? Are they being listened to? Basically reviewing what is their role currently in all kinds of work externally. And also because specifically students, because we are a student organization, it also reflects on having participation of youth, of students in all areas that will affect us. So for example, something very obvious would be medical education, which is a very widely accepted place where students are directly involved. A lot of the times, a lot of faculties have student representation bodies, not all of them, but in a lot of countries they have it. But not that many governments have, for example, students directly, a link with students to discuss ongoing health issues that will actually affect them. Think about what Skander talked about for climate change, etc. So the principle is to reflect on how meaningful is our participation, how can we increase meaningful participation, and how can we make sure that all of our members and everyone working in the IFMSA works towards meaning participation and not just students' presence. That's it.
Perfect. Yeah, so we hope that this gave you an overview both, I guess, on what we've already been working on and what our thoughts behind this proposal are for the upcoming time. And now we'll move into the questions time, and I can already see that there are some questions in this question and answer section, so I'm going to start with those. And it's going to be so that I read out the question, and then either I will answer it myself or I will find sort of an appropriate person in this call that can answer it. So the first question that I see is from Helene. To me, it seems that the different focus areas are different in how broad or how narrow they are. For example, the way I read the SRHR focus area, it seems quite broad and not really prioritizing within the topic of the standing committee. So I think it is also something that we have been struggling quite a lot with. How narrow can we go and how broad can we be? We we want to cover a lot of things, but at the same time, we want to change things to the way that we want to change things from how they are now, in which they can be quite broad, to something more specific without being too narrow at the same time. And I have to say that this is really something that we have discussed as well with the different liaison officers, and the liaison officers knowing their area the best, and thereby, with regards to the SRHR topic, I think that, unfortunately, I have to say that Michelina is probably the best person to talk to about this, and unfortunately she couldn't be here with us today. But as it is also something that we are asking you guys to adopt, we are also very open to hear your inputs and to discuss if you feel that some things could be more narrow or could be broader, or should include or should not include something. Yeah, so I think that's the best answer I can give you to that for now. The next one is a question from Fritz. He's saying, "Hey everybody, thank you for the overview. I couldn't connect from the beginning, so sorry if you haven't already mentioned this. If you have already mentioned this, namely, could you elaborate on the implications of the global focus fields on the regional priorities, please?" We have not addressed this at this moment. We've tried to explain it in the email thread. So for the moment, Europe is the only region that has external priorities, where Europe has sort of set 3 areas that they feel are the most important to them, and they have a similar kind of process to how this is going. What we are proposing from the TO side, and we've also been discussing this quite a lot with the regional director for Europe, is that that for most of the meetings that the RD Europe will attend, it will be most relevant for this person to focus on the European regional priorities, because most of the meetings that the RD Europe attends in external representation are related to the European region or even the European Union as such. So that's the clearest answer we can get on that. However, there might of course be exceptions where the meeting in the European Union is about SRHR related things, and then also we always collaborate with each other. So the LRA will collaborate with the Regional for Europe on this. The main place where it sort of interacts at the moment, or sort of intersects at the moment, are the WHO regional committees, which are the regional meetings of the WHO that precede both the WHO Executive Board meeting and the WHA, so the World Health Assembly, which is the annual General Assembly of the WHO. And here, really, the global external focus areas are relevant to the Regional Director of Europe. So here, it will be a compromise or an addition between both the global areas and the regional priorities. And this is very similar as well to how it has been done previously, where the regional director has been assessing both the regional priorities in external representation, as well as been talking to the Vice President for External Affairs and the several LOs. So that is the best answer we can give you for that. I hope it makes sense. And of course, we haven't had global external priorities or global external focus areas before. So it will be sort of a working in process, and we will try to find the best way forward. This proposal is still going to be sort of a one-year pilot to see if IFMSA really can benefit from working this way. Yeah, so that's it. Then several of the areas mentioned, that's the next question from Helene. Several of the areas mentioned capacity building, mentioned building capacities among medical students or health professionals. Is this really external? Isn't it rather internal? And wouldn't this really more be a topic for capacity building strategy? I might have misunderstood. So I think you're completely onto something that is quite important here, and definitely if it is so, it is, of course, it is internal whenever it says capacity building, but at the same time we do need the capacity building in order to have efficient and effective external representation. So we need to know what we're talking about, and also here we get into the standing committees, we get into the programs, we get into the local committees, right, where we have this is actually where people gain the skills and the knowledge that they need in order to actually do external representation with the knowledge that needs to precede to be in order to talk to partners that are at a high level for this. If there are specific fields or specific places within our document that you think that is not relevant to mention this, then please just let us know, and then we can definitely talk about taking it out, because it is true that it would go more into the capacity building strategy if it is mentioned as such.
If I may add something, I think it's very important that Helene mentioned that capacity is internal, but I think it's very important to look at it from a different approach, because liaison officers do not work separately, and standing committee directors do not work separately as well. There is this overarching or interlinking working mechanism between both, because capacity building, even though it happens internally, the technicalities, the methods, the guidelines, the frameworks, most of which do come from outside, from experts, because at the end of the day, as medical students, we are good at what we do, but we also may not be expert at certain topics, and this is where externals who work on certain fields are expert on. They have their guidelines, they have their frameworks, and this is where we bring external into internal, and we use these frameworks, we use these guidelines to build the capacity of members. And while liaison officers may not be the ones directly building the capacity, they do provide the opportunities for capacity building, either through trainings or attending conferences or attending workshops, consultations, or etc. And even during the general assemblies, during the regional meetings, liaison officers do hold a lot of workshops in coordination with the standing committee directors or with other personnel who may propose a workshop, to make sure there is this interlink between externals and internals to have this optimum environment for building the capacity. So we cannot say that capacity building is an internal process on its own, and we cannot definitely say it's an external process on its own. It does have to come from both aspects working together. So hopefully this also gives an idea or answers your question.
Thank you, Corinne.
Can I also add?
Could we both add something?
Yeah.
Okay. Sorry, Skander. Yeah, I think maybe the way that I talked about capacity building is a bit more in line with what you had in mind, which is not capacity building of our members, but it's of medical students, it's themselves, which is through medical schools. And other way around, if we talk about wanting to influence certain partners or certain processes, not everything can be achieved at the international level. For example, you can lobby internationally all you want, but if you want to make a change on a local level in a medical school, there's no organization that can actually mandate a medical school to make changes. So this is why, even though it's an external representation strategy on the international level, it would, for example, if we're talking about social accountability in medical schools, it would target medical schools to make these changes within their own faculties. Because even if we have an international organization, we have the World Federation for Medical Education, but they only provide guidelines and standards, but there's no organization or no government, no structure, no WHO that actually can mandate a medical school to change. So this is why targeting local students is so important, and building capacity of medical students through education is also, it's not building capacity of our members, it's building capacity through the educational system, in the case of the examples I mentioned.
Perfect. Thank you. Skander?
Yeah, just very briefly. Also, it would depend on the opportunities that we have in terms of external meetings or collaborations that we have that with organizations that would like to support students, especially when it comes to some tools that those organizations might have that are not necessarily suitable for medical students. So it is our role to simply simplify the message and also make it more adapt, so we can adapt it to the context of where our members are from, but also make it easier to understand.
Yeah, not sure the connection was perfect there, but yeah, I hope people got the main point. So the next question I have is from Frit. It says, just a follow-up, when setting future regional priorities, will they have to align with global focus field? And the answer for now is no. Because there are no, they are two independent sets of priorities at the moment. I believe maybe for some fields it would make a lot of sense to have the same or a similar area where they could then sort of add up to each other. And if we really start working effectively with one focus field within both Europe and at the global level, or at one region, at the regional and at the global level, then I really think that we can achieve something, and NMOs could really could also benefit a lot from this, and IFMSA at the global level, etc., etc. So I believe really it could make sense, but at the same time, I think some certain topics will be really relevant to some regions. And for example, we've talked a lot about trade and health and the TTIP agreement within Europe, and that is certainly something that is very important to Europe and also affects health within Europe as well as outside of Europe, but focusing on Europe because the deal is a lot about Europe and the US, right? Or it's between the Europe and the US. And thereby, I think that may still make sense to have that as priority for the region, but maybe we're not at a stage at the moment where trade and health would be a global focus area as such, just looking at the global health agenda with a bit of like broader glasses. So that would be my answer to that. And the next question is from Amin. Hello everybody, thank you again for the wonderful webinar. Regarding the external representation focus areas, will they also influence the rest of the Federation's work, namely the programs and activities, or will they only guide the TO, be to guide the TO's work? So for now, this proposal only concerns the external representation of the IFMSA. We believe that if we were proposing it to be relevant to all of IFMSA, we might actually be proposing a reform rather than be proposing just sort of, what we're proposing now is trying to just focus a little bit our external representation and trying to be more effective within our external representation and not touching as much on all of the internal things, because we are also going through a reform at the moment that we're trying to implement. So for now, it's only external. After this one-year pilot and all of the evaluation and monitoring that hopefully will happen next year, and evaluation of the IFMSA strategic plan that will also expire next year, where we will be having to sort of develop a new strategic plan for the term 2017, 2000, and maybe, I don't know, if it's 3 years ahead, 2020, then we might want to focus, well, we will see what the NMOs want and what the whole consultation process of the strategy will be then. But for now, this is only about external representation.
Marie, if I can add something. Actually, it sort of works the other way around. Like, it wouldn't be because we want to do some external representation, we're choosing these focus areas, but these focus areas are based on already existing programs, already existing policy statements, IFMSA's vision and mission, or the work of the standing committees. And you will see that there's also another proposal that suggests to focus more on certain areas, which is the capacity building strategy proposal, or the concept note. So we are definitely trying to see throughout the Federation if we can focus more, but where these principles come from and what they will affect is at this moment the external representation.
Yeah, and for sure, we also want to refer to our colleagues that have been working on the capacity building strategy. This is a really important step as well for our Federation. So please do have a look into that. The next question, I think, is for Skander, and it is, so a question, in the NCD focus area, will mental health be included as part of this?
Can you guys hear me?
Yes.
Yeah.
Yeah, perfect. So there have been some discussion whether mental health should be included or not, and of course it is part of the NCDs. However, it shall not be taken as a part, as we are also not tackling all of the NCDs separately. So, for example, there are many consultations and conferences that are happening on specific NCDs, let's say cancer, diabetes, like cardiovascular diseases, etc. But the overall idea is to focus on how much we can get prepared to address NCDs as medical students, but also focusing on the risk factors and the social determinants of health that for sure include mental health and try to also to address mental health. I'm hoping that it answers the question.
Wonderful. So now I'm just looking if there are any more questions. If any of you have any more questions, please raise them now. And guys, can you see any more questions anywhere?
I don't. Maybe if I could maybe just clarify the answer from about the opportunities. I was just referring to the training manual on climate and health. That is like represent an example of a great opportunity that we got from external organizations. But at the same time, we know that we need to build capacity on the topic. So it was also sort of merging the needs of the internal level, but also how much we can adapt to the external level. Yeah, that's it for myself.
Yeah. So I don't know how clear it is with the capacity building question, but I think some important points were raised around how our external partners do add up and add into the capacity building of IFMSA, and that is also one of the roles that we have as liaison officers, and that's something that we really get out of working in external representation for sure. And there was a new question, how appropriate, from Jamila. Hi everyone, one question. Thank you for your admirable work. I was curious about the process you went through to select these specific focus areas. Were other ones considered? Okay, that's a good question. So we have been going through a lot of different fields, and we've been trying to figure out what do we work in externally, what do we work in externally. We've tried to compromise a lot. We also discussed a lot how many should we have? Should we only have 3 focus areas? Should we have 15? We thought 15 would probably be too much. If we had 15, then we would probably be back to square one where we are now. So this was one of the big fears, that maybe if we had too many, then it wouldn't change this much. So I think the answer is yes, some other ones were considered. There have been some merging, and there have been a bit of negotiation. But this is the final proposal, and generally we're really happy with it from our side. Now we're just very open to hear what you guys think, because for sure there's no right and wrong answers to this. Yeah. Does anybody want to add something?
May I add also to that?
Yeah.
Yeah. I would also say that it depends on how much we had the capacity to actually have very strong position in accordance to the policy statements and the partnerships we have, especially last term and this term, so that we know exactly how we can concretely achieve for the next term. And I could also maybe go back to the mental health topic, since for example, we have a policy statement, we have a program, we are supposed to have a strong position, but from the past term and this term, there hasn't been much of specific focus on mental health. This is what perhaps makes us makes it a bit hard for us to actually, define how we can maybe, focus on it specifically.
And if I can just add to that, if I'm not wrong, then I think the action plan for mental health at the WHO was adopted in 2013, and before that was the resolution on mental health the year before. And this means that it was something that was kind of like a hot topic back then, and was really, really like relevant. Everybody talked about it. And then for now, maybe we have less partners that are really focusing on this, and this is where it becomes really clear how important it is to both assess sort of the internal areas and the internal capacities, as well as the external, because we want IFMSA to be important, to have a voice at the important ongoing processes, as well as the things that are important to us.
Just if I may add something as well, just combining answers to Jamila and And Amin, and also seconding what T has said, is that when we discussed about having the other way around of having the global focus areas tailored to the programs, the policy statements, and things that we work on, I think the global focus areas give the liaison officers, especially those working on external representation, also the regional directors to some extent, a sense of direction to what areas they need to focus on during their term. But let's also not forget that IFMSA is an open space. So at any point where a liaison officer or a regional director finds a point, a trending issue or something that's very important for medical students to act on, is also welcome to work on it, to build capacity on that. But as liaison officers, we do have wide issues and wide array of topics to work on. Having these global focus areas as minimal as possible gives us not only a sense of direction, but also makes the utilization of what resources we have as effective as possible. And hence, yes, there were a lot of topics that were considered, but the aim of having these number of global focus areas was to have our resources as effective as possible to these important ones. But again, just repeating at the end of my point is that at any point of time, a liaison officer, a regional director, or even a member that finds a point very pressing and very important for IFMSA to address and work on is more than welcome. So it's not really set to stone.
Thank you. I don't see any more questions now. Do any of you have anything you'd like to add? No? Okay. So I would just like to remind you that if you have some feedback, please, please, please write us. It's great if you want to share it with the rest of the NMOs. If you have some more questions that might be more detailed, or that you'd rather have a more personal approach or whatever, feel free to ask us those. It is also important for us to say that this is kind of like the framework, and then after we've adopted this, hopefully at the August meeting, then we will work on setting a strategy within each field for what we want to adopt, and then it will be the next team of official up to them to work on these and to monitor throughout the year how well we're actually doing within each one of them, and that would also make it possible for the NMOs to really follow the impact and the work that we're doing, that IFMSA is doing. And there's a question from Prit. How do you envision global focus areas will be set in the future? Will it be the same in that TO proposes areas, or will it be more like regional priorities where NMOs make the proposals first? So this is also something that we have discussed a lot, whether it should be the proposal should be coming from the TO, or whether the proposal should be coming from the NMOs. As I guess what we have concluded from all of our talks and discussions, it is that IFMSA works a lot in a lot of areas, and there are people within the team of officials that have the knowledge of what we did 5 years ago, what we've done the last 3 years, what we've done in depth this term, and have all of those sort of things briefly in their mind, and can just take these out and say, okay, but we work with this partner, actually they are proposing this now, and it would be really cool to tag along on this process, and IFMSA could really have an impact there. So people that both have the overview of the global health scene, which we know a lot of people in the NMOs do as well, but also know sort of in depth and in detail what IFMSA has done previously. We do believe that it's really, really important for the NMOs to be consulted in this process, and for NMOs to be able to propose changes to what the team of official is proposing, and to give input, and this is really why we're doing it. However, the conclusion is that for this term we're going to try with the TO proposing something, and then we will reevaluate and also maybe discuss with the NMOs probably how they thought of this process, as we also want to be sort of representative of the full federation, and not sort of limited to the ones that work mostly in external representation themselves. So that is the answer to the question. It's a bit difficult, and it's also difficult for us because it's a new way of working. Does anybody have anything to add to that? No? Okay.
All good.
All good. Perfect. And I don't see a follow-up coming from Chris. Maybe? No. So really, we've also been running for an hour now, so which I guess is an appropriate time for a webinar on a Tuesday night or day, or whatever time of the year or day it is for you. So I think we'll just end with this, and really thank you so much for all of your questions and for listening to our thoughts and our proposal. It's really nice to have your feedback and to have you involved in this. Very much appreciated. And thank you to the liaison officers.
I just wanted to apologize for the technical difficulties in the beginning. It was all my fault.
Kind of was doing technical things, and he did really well, despite the small delay. But yeah, so that's it. I think we're gonna hang up now, and it will probably be available for you guys to look over it again if you're interested in hearing some of our answers. And excuse us if there are any sort of minor things that we have said wrong or yeah, mistakes throughout the way. Please do approach us if you have anything for that. Okay, I think that's it. Thank you, everyone.
Thank you, guys. Thank you for joining, and
Thank you very much.
see you in Mexico.
See you in Mexico.
See you in Mexico. Bye bye.
Bye, guys. Bye bye.